This is where I work, we usually do. I'm going to start on the right hand because it's just easier because I'm right handed.
Can you bring your tape in this?
Here. Okay. Hang it up over there.
Okay.
Now, I've spiked and primed it, okay?
Okay.
Now, I always loosen this right here because what's going to happen if you have it on really tight, you're one-handed and you're trying to get it off one-handed and you're going to contaminate like that. So that's what you don't want to do. So I'll always loosen it just enough that it's loose but it doesn't come off, because it comes off, you contaminate. You cannot touch this to anything. And you will see people doing that. You'll see them, like where I work, they'll do this and I just cringe because that is now contaminated. If it touches anything, it's contaminated. So I just loosen it enough to where I can grab it and it just comes off without me having to contaminate it. Okay? Alright. So then, let's do it. I'll take my Capilon out and I do mine different than y'all do because I'm faster than you are, so I don't have to put my tourniquet on and take it off and then I'll take it off. And you'll get to where you're fast enough to do that too. And I'm not sure I'll do all the steps the way they showed you just because I can't remember how they showed you. So I'm going to put on the tourniquet. And you always start distal, right? Because if you blow that, you have to move up. You can't start below where you've blown the vein. Okay. So I'm going to look at it. I'm putting, let her hand hang over. I know they told you not to. So you can rub it like this, whatever it takes to get it to puff up. And she just really doesn't have much, does she? This is always a good one. I mean, you can look on me. This is a good one right here. I know they tell you not to do it right there on the bone, but that's always a good one. That's a good one. You can always usually find one there. There's always one that runs back here. But sometimes people that are bigger, they're hard to find. I can't even find one that's like here. She's like, well, here's a good right here. Here's a good one right here. Okay? So that's where I'm going to start. So I found my vein. Now, did they tell you to go ahead and clean now? Mm-hmm. I love these little doohickeys because this is chlorprep. Chlorprep, the cleaning action is the scrubbing action. So you kind of squeeze it and scrub at the same time. If you're using betadine, you have to start in the middle and work your way out, and you don't go over where you've already wiped. That's betadine. Chlorprep, you can just scrub the heck out of it because that's the way it cleans. And I like it because it's easy to hold as opposed to, and I always put it back in here, that way it keeps it clean if I have to use it again. If you're using an alcohol swab to clean it off, which is totally fine, it's just not as easy to use. I just like the chlorprep better. Okay, so I've cleaned it, and I'm going to loosen my tourniquet, okay, because 2 minutes is the rule now. All right, so now, the way they teach y'all is to clean off your table, right? And let that dry. And I always tear off that little end right there just because I don't like it. Okay, so let that dry. This is why you don't leave the tourniquet on. Okay. It takes you longer than you expect. Okay, so we're going to pretend like that's dry, okay? So I tear my tape in half like that. And I guess I do. You always just have them where they're easy to grab. Okay, so now I've got my tape torn. You're going to want to keep these because if they start bleeding, you need to clean up with those. I've got my offside, and I know that sometimes they tell you to go ahead and take them off. I don't do that. Just do it however you like it, but I don't do mine that way. Okay, so I'm going to put my tourniquet back on, and this is dried by now. And my thing is there ready to go. Now these have a little safety thing on them. If you hit that little white button, your needle is going to retract. It took me a long time to get used to that because we didn't use them for a long time. And I would always hit that sucker with my thumb and the needle would go up in here and I'd have to go get another one. Okay, so I get my patient's extremity and I'm going to pull on the skin because it makes it tight. Okay, so I pulled on the skin. It's dry. I got my tape torn. I got this. Everything's ready. And I just kind of go in. Let's see where it is. It's a big needle. That's an 18 gauge. But if you think you're going to give your patient blood or anything, or if they're going to need lots of fluids, use the big one. And Jimmy, this is the hub that I was talking about. It's green on this one. It's blue on the ones y'all use because y'all use the 22. Okay, so I stabilize it with my thumb. I pull down with my thumb, and I stabilize with my hand like this. So this way I'm not doing all this kind of stuff. Okay, especially when you're nervous. Okay, and then I just kind of go in at about a, what is that, about a 15-degree angle maybe, 20, 25. And I just go in, I push under, and then I start, so now I'm under the skin. That's the part that hurts. Once you get under the skin, you can kind of go, okay, I'm under the skin. Now you start looking for your vein. So you just kind of start pushing it in, and you see blood right here and right here. When you see blood right there, you know you're in. Advance it just a hair, not much, just a hair, because what you don't want is to go through the vein, because you've got a point on the end of that needle, right? If you keep pushing in, you run the risk of going through. But with the plastic thing, you're not going to go, you hope you don't go through the vein. So then you can start advancing your needle on in. Now see how my catheter's in, but my needle, I didn't go any farther with my needle? Okay, so now I'm going to put a finger at the end of where I think the end of my catheter is, and I'm going to put a finger on the green hub. Okay, what I'm doing is I'm stabilizing my green hub, and I'm occluding the vessel so I won't get a blood bath. And then I push my button. See how it retracted? And I get my thing right there. I still got it occluded, and I put it in, and release my tourniquet. And we have one of our CRNAs that if you don't screw that thing on, he comes and just yells at you. Okay, so see how I've never let go of this. I have never taken my hands off this, because if you do and they move, that sucker's pulling right out. It's not like a mannequin that's plastic. So you always hold on to it one way or another. So now I'm going to get my clamp, and I'm going to open it wide open. Okay, and now if I'm in there, look at it, it's going wide open, right? I know I'm in there because I'm not puffing up. Okay, so I'm going to slow it down, and you get good at doing this one-handed. I'm going to slow it down to a really, really, really slow drip, and I'm not going to worry about it right now, okay? Because I'm going to worry about this. I'll come back to that in a minute. But I've opened it wide open. I know I'm in there because I'm not puffing up. I'm running free flow. So this, I do mine a little different than y'all do. So I take my tape, or how they showed you. Okay, now I've got it taped down. I can take my hands off of it now because it's not, hopefully it's not going anywhere. And then I take my op side and I put it on, and you can't cover up the connection. You have to put it right below the connection right there, okay? You can't cover up the connection. And then I take off this. Now, you can take this, put it under, and you can do your little chevron thing, however they showed you to do it.
That's what they did.
Okay. And then you're always going to want to loop it like this because you don't want that loop to catch on anything. And you're done. And now you go back and set your drip rate. Once you know you're in there and you're all taped down, it's not going anywhere. Now you go back over here and you're setting your drip rate.
What is it?
6 drops every 15 seconds. Whatever, that's 50 milliliters an hour. Okay? So you count 1, 2, 3. That's a little fast. Let me slow it down. If I'm doing 6 drops every 15 seconds, it's a little fast. 1, 2. You have to, every time you adjust, you have to start all over. That's about right. Okay. And you know you're not going to be exact. You're as close as you can be, so. Okay? Yay. That's how you do it.